Hello everyone, George here, a UK pharmacist, and today's video is really important. For those that haven't seen, the US CDC has just changed the wording on its vaccine and autism page. I'll put the link below this video. It is now stating that the statement that there is no link between vaccines and autism is not backed by science, instead of clearly stating that there is no known link as per the scientific research that has come before. We have decades of data confirming that there is no causal connection, yet politics and online narratives have caused the CDC to change this wording and put an asterisk to state it as such. This has forced the major power, that is the CDC, that has lots of credibility, to change its wording, compromising scientific clarity. If this continues, healthcare around the world, not just in the US, is at an unprecedented risk. So let's talk in this video about why politics and healthcare should remain clearly segregated and how dangerous it is when they do not. I'll also cover how we can try and protect our healthcare systems from these political agendas, otherwise they're at risk of becoming collateral in political battles. So, when politics enters healthcare. So first off, let's have a look at what healthcare is. So healthcare relies on evidence, science, trust, confidence, equity, clinical judgment, whilst politics relies on popularity, ideologies, agendas, and election cycles. So when political agendas push science apart and political opinions push science to the side, patients stop becoming the priority and healthcare becomes a campaign tool, not a healthcare system that is kicked around from party to party as a buzzword, as a slogan, moving healthcare away from being a care system. And this is already happening as shown by that CDC change. So let's look at this incident as a live case study. In the United States and in the UK, clinical issues become a partisan slogan and campaign tool to win our hearts and our votes over. I link back to the UK with Brexit and the NHS, and also the King's Fund showed the NHS is such a clear voter decision, thus creating an element of distrust, and when trust is lost in healthcare, the system collapses. And once healthcare becomes politicised and that trust is gone, it is incredibly hard to get back and undoes decades of building and maintaining those foundations. So this CDC update on their website relating to vaccines and autism is a clinical warning, is a clear warning. The scientific message is being softened due to political agendas and opinions, all to avoid a political backlash, all to avoid being sued in the American system. This is how progress that has taken so many years and so much research to build gets undone basically overnight. And yes, that's in the US, but the UK is not immune. As mentioned, healthcare systems become political agendas these politicians run with in their cycles, and the NHS is no different. It becomes a political football. We can all link back to the whole Brexit, with the NHS investment being a huge reason that won voters over. The King's Fund also did a report that highlights that the NHS is so big in the UK that it wins the hearts and minds of those votings, and therefore for political parties, they use the NHS to win our vote, win our hearts, and sometimes do not follow through. They also select short-term wins that aren't necessarily helpful to the long-term plan of the NHS, only to get our votes. They want those quick, shiny wins, the ones that win headlines, rather than the maybe more mundane, but needed and necessary changes to be made in the NHS. So therefore, the long-term planning and the long-term priorities get sidelined for the short-term wins by these political parties that are able to inject that money quickly, but potentially into the wrong places. These short-term promises create distrust and are constantly wasting money in the wrong areas of healthcare. Also, constant reforms and constant political parties coming through with these new novel ideas also create that wasting of that money, and also just creates more instability. And finally, prevention just gets ignored. Prevention is too long-term in the politician's mind. They want those quick wins, those waiting time reductions in certain areas so they can win the headline, rather than really looking at prevention, screening, and obviously vaccines coming alongside that, which kind of links back into the CDC stuff. Prevention basically doesn't win elections. It's too long term. So we as healthcare professionals on the front line see those consequences daily. Workforce burnout, widening inequalities in healthcare, missed targets, and then getting scolded for those missed targets, and then public frustration because the money's being spent in the NHS by these politicians, but in the wrong way. So therefore, people look at the NHS as failing and all this stuff, but it's kind of coming from the wrong root cause of being those quick wins over that long-term mindset and to improve the NHS. So if the UK follows the US down this political healthcare line, we are at risk of greater mistrust in NHS, and the NHS neutrality is at risk, which is what the NHS is founded on. Being neutral, being free for all, being equitable, but also being sustainable. So when messaging becomes too political, we really lose what healthcare should be. Healthcare is based off of trust, and I'm afraid politicians don't carry that much trust. So when they're too intertwined, healthcare loses its most valuable asset. So when healthcare seems too political, people do look for online advocates, celebrities, social media personalities, influencers, conspiracy groups to try and confirm their narrative, confirm their bias, to try and get some kind of understanding from the wider society. And those people listed do carry that position in society. So it is understandable why their views carry quite far. But they are not healthcare professionals. They are not the ones writing the science-based guidelines. So sometimes, as we mentioned before, the negative news travels faster than the positive, more mundane news. All of this results in prevention, screening, vaccinations declining, misinformation overload, people seeking these expert people for things they are not experts in. We're seeing more preventable diseases coming up. Measles is back in the UK, which is very concerning. And also more pressure on hospitals, which is a vicious cycle, because obviously the more pressure on hospitals, the more demand there is, the more waiting times go up, the more money they put in waiting times, away from the prevention. And it is that we're just burning more money firefighting than will that long-term projection to try and reduce those risks. And this, in my eyes, all comes from that political agendas that the NHS is being used for. So, is there any light at the end of the tunnel? So I think there is. So what do we need to do? So first off, we need to protect the trust and gain and maintain and continue to develop that trust with patients and healthcare, that we are here for your best outcome. So one way we can do that is making sure that scientific agencies are not influenced by political agendas. The NHS strategy must always extend beyond electoral cycles, and messaging must remain honest, clear, concise, with the patient at the forefront. It shouldn't just be a convenience. And investment must prioritise workforce, prevention, and future long-term planning. And also, transparency must never be compromised. Yes, science changes, but it should be the science that changes the narrative, not political agendas and ideologies. And healthcare must only answer to evidence, not to Parliament. So, I'm not saying politicians do not have a role in enabling healthcare to develop. They control the fundings, they control the laws, they control the legislation. I understand that. But they must never be in control of the clinical narrative, and science should always prevail with the patient at the forefront of that decision. But when these political campaigns, narrative ideologies win, it is the patients and those staffing that miss out the most. We as healthcare professionals want to deliver the best care in the best environment to the most people. We must speak up against these political agendas, because otherwise you're going to have these people, politicians, that are not scientifically inept, making the decisions that impact the patients, which decrease the trust, which decrease the outcomes of those patients. And then healthcare then is asked to pick up them because they are not as healthy as they could or should be. So, that's my soapbox moment, but I would love to hear from you. How do we protect the NHS integrity when everything else is being politicised? Also, if you found this video helpful, drop a comment, like, share it. I'd love to hear your views. I'd love to hear if you have the same or different ideas to me. At the bottom line, we need to keep healthcare in the hands of those that care and have the scientific understanding and long-term thinking of the NHS, with patients at the heart of the decision, not those on an electoral cycle trying to win the votes of the masses. So that's all from me. Thanks for watching, and I'll see you in the next video.